What type of doctor is best for filler treatment?
Injectable filler placement for a wide range of cosmetic issues is very popular. It has resulted in a wide range of practitioners offering these types of procedures. A question which is often heard is, who do I go to for the best results of filler treatment? I'll discuss the principles of safety and after-treatment management which I believe are important to understand when you're looking for the right doctor to perform your injectable filler treatment. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I'm well known for cosmetic surgery such as upper eyelid surgery, under-eye bag surgery, eyebrow lifts, facelifts, and other surgeries to treat the effects of facial aging. I'm also known for my work with cosmetic filler placement for the eyes and face related to the genetic and aging issues wherever there is volume deficiency. A common belief is that results are dependent on the brand of the filler. Although the choice of filler is important, it's the doctor's technique that is critical to a desirable result. It boils down to experience, expertise, knowledge, and the aesthetic style of the practitioner. Safety is the highest priority. Injectable fillers have become so popular that most people don't view them as invasive, particularly in contrast to surgery. Once you enter the skin, the procedure is invasive. With this principle in mind, I treat placement of injectable fillers with the same level of care as I do with surgery. As with surgery, you begin first with a plan. You should have a clear understanding about what you should expect after the procedure in terms of results and longevity. There are common issues after filler placement, such as swelling and lumpiness, which are generally resolved with conservative therapy. Since these are common and more severe complications are less common, both patients and practitioners can be inattentive to the risks of more serious complications. These complications include different types of infections, such as biofilm. A biofilm typically occurs when bacteria from the skin surface is carried past the skin and the bacteria attaches to the surface of the filler material. Since the filler material does not have a blood supply, infection can occur, which can be very difficult to treat. Another potential complication is when the filler material is injected into a vessel, specifically an artery. This can result in severe loss of large areas of skin and soft tissue and even blindness. Just like our approach to surgery, where we perform every procedure prepared for an emergency, it's important to have the necessary equipment, training, supplies, and always be prepared for any filler-related emergency. As a surgeon, I'm available to my patients 24 hours a day, including my patients who I perform injectable fillers for. When it comes to filler placement, I believe that the knowledge derived from surgical exposure is unparalleled. Since you cannot see through the skin, the placement of filler is dependent on how the different levels of tissue feel. I often see patients who are dissatisfied with filler placement around the eyes. Consistently, the practitioner who performed this procedure is not someone who is a surgeon who operates in the eye area. The eye area is a very small and very delicate area. A surgeon like myself who specializes in eyelid surgery and performs filler placement in this area routinely is less likely to have issues. No doctor is above having complications or dissatisfied patients, but I would argue that higher level of expertise and experience is always to a person's advantage. I've also observed that the scope of a doctor's specialty very often biases the doctor's recommendations. For example, in the case of under eye bags, slight eye bags can be blended and camouflaged effectively with filler. However, if eye bags are too prominent, then filler can actually make the eye bags look worse. In such cases, I would recommend to the patient to have surgery instead of filler, even if the patient states that they are not interested in surgery. I'd rather not treat the person than treat them incorrectly. I've seen many non-surgeons use fillers, resulting in a way to make the under eye bags look significantly worse. I see patients in this type of situation and dissolve the fillers to reveal the true underlying anatomy. Filler placement under the eyes is often associated with bruising because of the eyelid area being very vascular. As a cosmetic eyelid surgeon, I apply my knowledge and experience to place fillers with minimal trauma using blunt cannulas. This approach results in less recovery time and more immediate results. The same principle applies to treating hollowness in the upper eyelids. As an oculofacial plastic surgeon, I place fillers in a way which creates a natural and stable appearance with avoidance of common problems such as the filler getting lost in the eye socket. A frequently requested facial filler treatment is to restore volume or to enhance the cheeks. Most doctors place filler in the soft tissue space, which is just below the skin. Placing cheek filler in this area may look good at first, but the filler will shift, making this added volume in your face look soft and doughy instead of being defined. The skin can't hold too much filler material before it weighs down the cheeks, contributing to a rounded or pillowy, unnatural appearance. As a facial cosmetic surgeon who performs procedures like facelifts and facial implants, I know the anatomy of the face and the cheeks. This knowledge and experience has aided my ability to place filler at a deeper level of the face between the bone structure and the overlying muscle. This is called structural volumizing. Placing filler at this structural level gives a more defined, natural-looking contour to create a more youthful appearance. Nothing inspires more concern about an unnatural look than the subject of lip fillers. I have this discussion every day with patients who are considering lip enhancement. It always begins with the phrase, "I don't want duck lips," or "I don't want lips like," place the celebrity name there. Although this discussion is lighthearted, complications from lip filler placement can be quite serious. Lip injections have resulted in vascular compromise and resultant tissue loss. As a surgeon, before the introduction of modern hyaluronic acid fillers, I've augmented the lips with fat, with SMAS tissue during the facelift surgery, and alloderm. The principles applied to these procedures are also applied when I place filler for volume enhancement with blunt cannulas. Lip enhancement involves several areas which can be enhanced to create natural and attractive-looking lips. The ease of finding a practitioner for cosmetic filler placement makes it seem like an easy, non-surgical procedure without risk. Filler placement is not to be taken lightly, and it should be seen as invasive as surgery. Proper analysis, planning, adherence to standards for sterility, and preparation for complications are critically important. This means the practitioner you choose should be held to the same high standard you would apply if you were to undergo surgery. I hope you found this information helpful. Thank you for your question.